He manages patients' conditions associated with arthritis, trauma, and sports injuries, among other musculoskeletal conditions. In this episode of Doctor's Diary, we feature Dr. Ezekiel Oburu, an orthopedic surgeon who is devoted to helping his patients return to an active and more productive life.
My name is Ezekiel Oburu. I am an orthopedic surgeon at Nairobi Spine and Orthopedic Center. That is, our office is in Upper Hill, Hospital Road.
His journey in the medical world dates way back. Growing up as a child, all he aspired to become was a doctor. He is now living that dream and transforming the lives of his patients one at a time.
Orthopedic surgery is a discipline in medicine where we deal with bones and joints and ligaments, and we essentially treat musculoskeletal diseases. Musculoskeletal diseases are diseases that involve your bones and your joints and your ligaments and your tendons and your muscles. So if you have a problem with maybe a broken bone, you're involved in an accident, or you twisted your ankle or your knee, or if you dislocate your shoulder, or if you dislocate your ankle, dislocate your wrist, elbow, we are the ones who would fix that. So if you're involved in sports and you have an injury, an orthopedic surgeon is the right person to see. Well, I wanted to become a doctor from the time I was in primary school. I have got no idea who put that idea in my mind. Maybe I would blame my parents, but I wanted to become a doctor from that time. Initially, I wanted to become a neurosurgeon because all of us read Gifted Hands by Ben Carson. I went to school here in Nairobi, public school. I went to City Primary School first, and then I transferred to Nairobi Primary School. I went to Strathmore High School. After Strathmore High School, I went to I went to Strathmore College at that time. I was doing computers, so we were the first class, inaugural class of something called IDPM, which was basically data processing. At that time, it was 1991, so there was not much computers even happening in the country. So it took pass some time, but then after that, I went to medical school. After medical school, I went to do my surgical training. So I wanted to become a doctor, probably a neurosurgeon. But when you go through medical school, you learn many things because, you know, that was such a narrow perspective. So when I went to medical school, I learned, there are other branches of medicine. And when I was in medical school, I decided, no, I want to become a kidney specialist. So I want to become a physician, a nephrologist. But many things happened, and I ended up in surgery. It's a long, windy story. I wanted to do orthopedics, and I did orthopedics. And I took some time after working a little bit as an orthopedic surgeon to subspecialize in foot and ankle surgery and in shoulder surgery, because I saw at that time that there was a need in the country that we didn't have a foot and ankle specialist. So I thought that I would. So I still do quite a bit of general orthopedics, but obviously I'm trying to create awareness in other areas like foot and ankle and shoulder surgery.
To actualize his dream, Dr. Oburu had to confront the greatest concern that most students who choose a career in medicine often face, the timelines that seem daunting. In 1992, his higher learning education journey kicked off at the University of Nairobi School of Medicine.
I trained there for 6 years from 1992 to 1998. I went and I did my internship in Mombasa at the Coast Provincial General Hospital. After that, I came for my master's in general surgery because we did not have orthopedic training immediately in this country at that time. So did that from 1998 to 2004, worked a little bit, went to Scotland for 6 years, from end of 2005, and I was there until end of 2011 doing orthopedics, studying orthopedics, working in various hospitals. Then went to Australia for 8 months, came, worked again a little bit, went to Baltimore in 2016 for 6 months, and then in Stoke-on-Trent for 6 months. So in Baltimore I was doing foot and ankle surgery, and in Stoke I was doing shoulder surgery. So it takes a long time to train as an orthopedic surgeon. My journey is a bit more windy than most people. So most people will at least take 6 years of medical school or 5 years of medical school, a year of internship, and then they will take about 4 to 5 years of training as an orthopedic surgeon and 1 year of fellowship. Now, during fellowship, you learn a specific branch of orthopedics. So, like for example, we have various branches. We have trauma, we have hip and knees, where you get a hip or a knee replacement. We have pediatric orthopedics, so they're orthopedic surgeons, but they just mainly treat children. We have sports medicine. We have foot and ankle orthopedics. We have hand surgery. We have shoulder and elbow orthopedics. We've got tumors, and spine. So orthopedics is very wide. By and large, my practice is, I would say, maybe 70 to 80% general orthopedics, and about 20 to 30% foot and ankle orthopedics.
His vast experience both locally and further afield plays a critical role in management of his patients.
So medicine as a whole, and orthopedics not being an exception, has really advanced over the last 15, 20 years. It is really mind-blowing what has happened in medicine. So even since I trained as an orthopedic surgeon, between 2006 and 2012, a lot has happened. And so as a doctor, you have to keep up with the times. Some disciplines in orthopedics are relatively new. They were not even there in the past, like the discipline of shoulder and elbow surgery. It's not very old, maybe started in the 1980s as a subspecialty. Foot and ankle has been there for long, but also just people concentrating and doing that alone, right, is more recent in many countries, and we are trying to catch up with some countries which have already done it. So when people subspecialize, they acquire skills that were not available before. So, like one of the things that we do routinely in knee surgery and in shoulder surgery is keyhole surgery. It's not a very novel technique, I would say now, because it's been there for years. But just the fact that if you have like a dislocating shoulder, you don't necessarily have to have open surgery for the same. You can just have that through keyhole surgery. If you've got pain in your shoulder and you've got the tendons that give your shoulder problems, you can do that through keyhole surgery, and you're operating with, we call it arthroscopy. The same thing with the knee. So yesterday I was with a colleague and we're performing an ACL reconstruction, which is anterior cruciate ligament reconstruction. And these patients are torn their ligaments, and you do that through just keyhole surgery. So things have changed. Patients are demanding more and more less invasive surgeries, quicker recovery. And then the other thing that has also changed is just the fact that in the past, patients could spend a lot of time in hospital. So we now discharge patients much faster. A patient can have a hip replacement or a knee replacement, and they can walk the next day. They can go home the next day. And a patient can also just have day surgery. We are obviously conducting this interview at Nairobi Spinal Orthopedic Center, and we have a day surgery theater, and we are able to do some operations which in the past, and still in some hospitals, are done with admission as inpatient, but we're able to do ankle fractures. You can fix a forearm fracture. You can even do a ligament reconstruction as day surgery, and the patients can go home. And many patients want this, especially during COVID time. I've had patients who are telling me that, look here, I do not want to go to hospital. Can you fix it here?
When he is not at the clinic, he passes down the knowledge to students at the University of Nairobi, where he teaches both undergraduates and postgraduate students. Away from his busy schedule, Dr. Oburu says he loves spending time with family, as family, like they say, improves the overall well-being of an individual.
Family is I think, key. It's what, makes life sometimes worth living. So spending time with my family, that is one. Spending time with my extended family, that's another thing. And also, faith is also important for one to be grounded.
Like any other orthopedic surgeon, Dr. Oburu devotes his time in diagnosis, prevention and treatment of disorders of the bones, among others, and their treatment vary depending on the severity of the condition. But how does he balance work and family?
I think in this country it's unpredictable, because I think in other countries it's easier because you have a set schedule that you things you do. So, for example, if you're so the life of an orthopedic surgeon is essentially you do clinics, you do ward rounds, and you do surgeries. So I try to schedule my surgeries on specific days. I try as much as I can. So like today would be a day that I'm going to be operating. But sometimes you can't, because something can just come up and you have to leave that. So you try and maximize when you can, especially with your kids, because they're only going to be there for a very brief period of time. And you try and work your schedule around that. At least I've tried that. It's not always easy here because of just the unpredictability, but hopefully that will change.
He says he is yet to find a hobby though.
I think I've tried to develop various hobbies over the years. I must be honest, I'd not be very truthful if I picked on one. Yeah, it's a work in progress.
The doctor, who believes in making a difference in people's lives, advises the young and ambitious to work hard and hone their skills in a bid to survive in the ever-changing and highly competitive world.
I believe in working hard, and if you could ask me about working hard or even just working to become good at your skill, I could give you the number of hours I've spent just trying to learn my art very well. Having said that, I also believe that, and not to sound philosophical or anything, that a lot of what has been granted to us is because of things that are beyond us. So, like for example, I would say that a lot of what has been granted to me is God's favor. So some people would call it predestination, or I depends on what you call it. But so I think that there's a lot of just the background of being born with parents who went to school. That alone gave me an advantage over many people in terms of getting to where I did get, and therefore I think it's always good to have a healthy perspective about that, so that hubris does not creep in, and it gives you an attitude where when you see someone, you feel that you're there, but for God's grace you would be elsewhere. And then I think also, when you're a doctor, you tend to see, at least when you're in training in medicine, you tend to see, you see children, newborns, and everything, and also just pediatrics. Even in my practice, I still see some pediatrics, and you see very old people. And we are all humans. Yeah, a child does not see class, doesn't see race, doesn't see all those things. And when you're When you're old, those things, I hope those barriers and layers disappear. I once remember when I was in Scotland, I operated on this gentleman who was in his 70s, I think, and he was demented. And he had been a professor of law at Cambridge. And it didn't matter at that time. And probably it doesn't matter even when you're doing the job. These are positions that the good Lord has put in us so that we can make a difference in the lives of people.
He has a word for his fellow practitioners.
Sometimes money is not an end. You may not make as much money, but if you do a good job, you will receive satisfaction. And I'm not saying, I don't know what the English word would be. It is something that I've experienced. There was a time in my practice when I honestly did not have much work that was paying in private, but I said to myself, even if I operate on patients who can't pay, I will still get satisfaction. And I did. And it was a very satisfying moment in my life. I think watch out for any form of pride that may creep in. Pride is very subtle. They say pride is like bad breath. You're the last person to realize you have it. So watch out for pride. I remember once being in some rural town somewhere and asking myself what I was doing there. And I had a good candid conversation with myself and said, how proud is that statement you've said? You want to say that you're in this rural place so people here don't deserve you? All patients are the same, whether they can pay or they can't pay. That's the thing. I think to the general public is please go and see an orthopedic surgeon or go and see a doctor. It takes a long time to train doctors. So going to the chemist and you meet somebody who's hardly opened a textbook in these disciplines and is going to prescribe painkillers or antibiotics will not solve your problem. It takes a long time. So go and see the doctor and the doctor will tell you what to do. Our job as doctors, or the doctor will give you advice. Our job as doctors, we don't tell patients what to do this or this. We advise patients. We say, this is your problem. You have arthritis of the hip. I think you could benefit from a hip replacement. So the patient will ask us, what does that entail? And we will, what is it called? We'll tell the patient this is what it entails, these are the pros, these are the cons. And then we will tell the patient, well, what do you want me to do? And the patient will decide. The days when doctor used to tell the patient, you do this, those days are gone. It's a decision that you make with the patient. Some patients are a bit uncomfortable with that, but we are never going to push a patient to that. And doctors, I think there's this perception that patients have, that doctors mess people up. I can tell you I'm a doctor, and I work with many doctors. Many of my friends are doctors. When a patient or surgery complicates, or things do not go as planned, one of the most heartbroken people are doctors. So it's just that you have to get on with the job. But we don't take patients to theater willy-nilly. At least I don't, and I know many of my colleagues certainly here do not take patients to theater willy-nilly. We want to operate because that's our job, but if I am not operating, it's not because if I'm not getting patients to operate, it's not because I am conservative necessarily with even dismissing patients who need surgery. It's just because maybe I'm not finding the right people, I'm not looking in the right places. So go and see your doctor. And sometimes we treat patients for free. Not all patients, because we have got bills to pay. But sometimes patients think that we're just after money. And I can tell you, I personally I think healthcare is a human right. I think healthcare is like education. Everyone should have access to healthcare.
Dr. Oburu's mantra is simple. We can be anything we choose to be. So, work hard, pursue your dreams, and you will get results. Gloria Milimu, KTN News.